What's up, guys? So now it's actually the middle of a pandemic right now, the COVID-19 pandemic. So instead of me going to school doing clinics, I just decided that throughout this pandemic season, I am just going to educate you guys about dentistry. As far as you guys know, I'm a dental student, I'm a clinician already. So, yeah, my future videos will be lecturing about the various stuff that we use for dentistry. And since I'm a Clinic 3 already, working Clinic 3, so we have our endodontics, we have our surgery done already. So yeah, just to keep me just to keep me refreshed from my dentistry course, and also to educate you guys about dentistry. Dentistry is a very fun, very fun course. So yeah. Um so basically, I have my equipments here, my materials. This is for my surgery materials, and this is for my endodontics materials. Okay, so I'm going to explain to you guys about each and every material being used here in dentistry, so that I can I can keep myself refreshed from my dental course, and also you guys can learn from me about dental materials also, and also dentistry. And also these are my scrub suits, what they call this, scrub suits for my surgery. And yeah, welcome to the world of dentistry. This is one of my uh this is one of my project this pandemic season. It's all about dental videos coming from me. So yeah, without further ado, I'm going to start with the surgery first, because surgery is very fun. So yeah, here we have my needles container. We have the short needle and then the long needle. The difference, the difference with this one, with the both of them, the orange one, this one is a long needle, and then the yellow one is a short needle. So why do we have two needles in dentistry? The short needle is for the anterior. If you're going to have anesthesia, okay, the short needle is good for the anterior portion of the mouth. If you're going to do ASAN technique, ASAN block, or the anterior nasal, no, ASAN means anterior block. Okay, ASAN is in between the canine and the first lateral incisor that you're going to inject this one. And it's okay for the MSAN also, middle injection. You can use this one. You can use the short needle for the MSAN and the ASAN. However, for the long needle, okay, long needle is used for posterior. Any posterior is fine. Or it's okay for the PSAN, and then the MSAN that you can use for the what you call this, injection. Okay, for the anesthetic. And this, of course, is the uh you cannot see it. Oh, here, needle, suturing needle. Okay, this is used for suturing the wound after we're going to do our what they call this, to do our extraction using with the forceps, we're going to do a suture needle. This suture needle is for this one also, suturing thread. This is the suturing thread that we're going to use for the suture. This is non-resorbable, which means that after extraction, we need to suture it, and after 1 week of hold on there. After 1 week of what do you call this? After 1 week of the extraction, we, you need to go back. You need to go back to us, to the dentist, to have this one removed. This one, the suturing thread, and of course the lidocaine. Surgery needs a lot of lidocaine. Lidocaine is the anesthetic being used for the what do you call this, anesthesia, local anesthesia, so that you will not feel any pain if we're going to do any dental procedures. This is the lidocaine, 2% epinephrine, 1:100,000. So yeah, the way lidocaine works is to block the receptors of the pain receptors in your body. So yeah, this could be used in the ASAN, PSAN, and then the MSAN also. And of course, this is the gauze that we use. The gauze is very, very important because it's to control the bleeding of the patient, and also if we're going to do elevating the tooth, and yeah, the gauze is very, very important also. And of course, the sterilizing pouch. That sterilizing pouch is very, very important, so that to keep your instruments sterilized, keep clean and bacteria free. Okay, so yeah, I have this one also, and I have the prescription. This is the prescription that we have. Most commonly, the mefenamic acid is used, and of course the betadine or the Bactidol. After the extraction, we're going to put Bactidol on the gauze, and then let the patient bite for 30 minutes, for at least 30 minutes. And of course the sodium chloride or the NSS. After we're going to do extraction, the tooth has been pulled out. Okay, we're going to do the normal saline solution to keep it clean, to keep the extraction site clean. It's very, very important also in dentistry, sodium chloride. And also the bib, very, very important. The bib is very, very important, so that to keep the drape over your patient. And also the forceps. Oh fudge. Okay, never mind. So this is the forceps. I know it's dirty, I have to clean it, but yeah. I am not using this one on a live patient. So yeah, the one I used for the live patient is back there in school, but I couldn't get it. I couldn't get it. This is the tissue forceps to prevent bleeding. You see? So yeah. And then this is the forceps also, the tissue forceps to control bleeding as well. I am not using this one on the live patient, as you can see. So yeah, This is the specimen container. I have like fudge. Specimen container. I haven't done any clinics for the past 3 months. It's because of this COVID-19. It's very, very not safe for us to be handling patients right now. So yeah, um, this is the specimen container. After we're going to do extraction, we're going to put the tooth here into the specimen container. And yeah, I have the suturing needle here. And yeah, this is for the 10 ml, 10 milliliters, 10 cc syringe. This is used for irrigation. Okay. Wait. Oh yeah, this one and this and then this one. You get the NSS out, and then after that get the needle out, and then after that you're going to do some irrigation on the extraction site. Very, very nice thing to do. This is what we used for irrigation as well. Oh yeah, and also I have one piece surgical silk here, or the surgical thread, and also this is the sterile, or the surgical blade. This is very, very sharp. Very, very sharp. This is used for incising tissues if we're going to do epicoectomy, and also different surgical techniques that you're going to use. Surgical blade. So yeah, I hope you guys can learn something in dentistry. So yeah, I'm really, really excited to go back to dentistry to do clinics and finish my requirements. Hopefully, if this COVID will be done. If this COVID will be done, then I don't know. I'm very, very excited. Very, very excited to go back, to be honest, and continue my cases. So yeah, this is, I think this is the future of my YouTube videos, is to give you guys an educational tour about dentistry. So yeah, this is my endodontics stuff. As you can see here, this is for the needles, long short needles, and then this is for the lidocaine, and this is the x-ray. As you can see here, third molar is in the impacted third molar, and then yeah, and yeah, as you can see here, concut. So yeah, impacted third molar, and then the first molar is kinda effed up and needs to be root canaled. So yeah, and this is basically AH plus. This is a special type of cement that we're going to use for after cementing with the gutta percha into the root canal. If we're going to do if we're going to be done with everything, with the masticone, and then the step back technique, and then just basically enlarging the canal, we're going to fill up with a special type of cement, which is the AH plus, together with the gutta percha. And this is the paper points. The paper points is used to dry up the canal. It is used to dry up the canal So yeah, and the rest of my I have four of these boxes, but the other two is in school. So yeah, this is used to dry up the canal if we're done enlarging with sodium hypochlorite solution with water, of course, diluted. It's case to case basis. And this is the gutta percha that I'm talking about. This is the gutta percha with the AH plus cement over here. This goes along well with the gutta percha with the AH plus cement, of course. So yeah, and this is for the oral hex or the mouthwash that you're going to use. Contains chlorhexidine gluconate, Orahex plus oral rinse. So yeah, and this is the rubber dam sheet. If we're going to do any root canal, the rubber dam sheet with the rubber dam frame, you will put this one onto the tooth so that to prevent bacterial or saliva contamination of the tooth that you're working with. And of course, the calcium hydroxide cement or the Diapex. This is very very expensive, very expensive. You know, um, the way we use this one is to seal up the root canal. Seal up the root canal first, and um, depending on how curious the tooth is, usually goes for two to three visits. So we're going to put this one onto the canal so that this has antibacterial properties as well, calcium hydroxide. So yeah, pretty neat material that you're going to use. So yeah, seal up the root canal first, and after sealing up the root canal, okay, come back again for 2 or 3 meetings, and then yeah, onto the final cementation. This is of course the no, EDDA solution. The EDDA solution can obviously um dil- dilute or what do you call this? Dilute or can absorb or can what do you call this? I forgot I don't know the word in English, but yeah, it can basically it can like mix up with other chemical composition so that it can be together and be be done be absorbed with the solution. And of course the you will basically, this is for the irrigation, root canal irrigation, for the EDDA solution, and then for the sodium hypochlorite plus water solution. This is exactly what we use it for, the syringe. And of course the files. The files comes in various sizes and various shapes also to clean up the root canal, of course. And this is the rubber dam frame that I was talking to you about. So yeah, I hope you enjoy my little tour about my dental materials, and for sure more to come. More to come in the future. More to come in the future. So yeah, um, this is the future of my YouTube videos is that I'll be talking about various dental instruments that I have right now currently have. It's because majority of my dental instruments are there in school. Well, not all, but the ones that I commonly use are in school. So yeah, I hope you guys enjoy my video, my little tour about what's going on about my dental practice and then the dental materials right over here. So yeah, I hope I gave you guys an educational video. So yeah, bye guys. See you in another episode of Marfar SP or Umid's vlog. So yeah, bye. Bye bye. It's because this is my YouTube channel, so I can basically educate you guys with dentistry. So yeah, bye.